Hello everyone, in this video we will be demonstrating per speculum examination, per vaginal examination and how to take PAP smear. So come let us see in detail. So before doing any examination or like doing a per speculum or per vaginal examination, the prerequisites have to be followed. That is, first of all, take a verbal consent from the patient. But if you are doing any operative procedure, then you have to take written informed consent from the patient. Second point is always evacuation of bladder. So ask the patient to evacuate the bladder. Then patient comes and lies down on the bed. Then what is the position? She will lie down in dorsal lithotomy position. Exposure of the perineum will be done. In the presence of a female attendant, examination will be done in a bright lit room and we will stand on the leg and side of the patient. Then we will wear sterile gloves. Sterile gloves are worn. And painting and draping is done of the perineum. So these all prerequisites you have to tell before you start with the procedure. So come let us do the per speculum examination. In per speculum examination you can do it with SIMS and anterior vaginal wall retractor also. This is SIMS double bladed hollow metallic posterior vaginal wall retractor. So it is used to retract the posterior vaginal wall. With this you take the SIMS anterior vaginal wall retractor. Okay, don't confuse it with a uterine curette. Curette is smaller version of this. Okay, so you insert the SIMS speculum this way, just parallel to the vagina, and then rotate it backwards so that it retracts the posterior vaginal wall. At this time you retract the anterior vaginal wall with the anterior vaginal wall retractor. So when you retract like this, you can easily see the cervix inside. Cervix is visible. Now whatever procedure you are doing, be it a PAP smear, be it doing a polypectomy, or if you are doing a dilatation and curettage, you proceed further. So in dilatation curettage, you catch hold of the cervix with valsalum and then proceed with it. Similarly, here you need the assistant along with you because your two hands will be engaged. But if you are doing it with the Cusco speculum, this is Cusco's bivalved duck-billed, because of its shape it is duck-billed metallic self-retaining vaginal wall retractor. Don't say it posterior vaginal wall retractor because anterior and posterior both are retracted by it. Similarly, you insert it this way parallel to the vagina, then you rotate it and then you open it so that the cervix is visible inside. You can see the cervix is visible. When the cervix is visible, you can just rotate this knob and fix it at this position. It will be a self-retaining speculum which will be retained it by itself. So it is retaining by itself. Now suppose if we are taking a PAP smear. So for PAP smear you have an IR spatula. This is an IR spatula. This has two ends. One is this and the other is this. This end is used to take PAP smear. So whenever you are taking it with this IR spatula will take cells from the ectocervix, that is the outside of the cervix. So we will rotate this 360 degree on the outer surface of the cervix so that the cells are taken. Basically PAP smear is exfoliative cytology. You should remember this term. Exfoliative means the cells which are shed from the cervix will be taken up. So what we do is we locate the cervix and then in the cervix 360 degree rotation of the IR spatula will take all the cells from the cervix. Once the cells have been taken, now we will take frosted micro slide. These are frosted slides. What do you mean by frosted slide? I'll tell you now. See, suppose this slide, okay, part of it will be frosted. So here you will not have glass, it is frosted, okay. The rest of it where there is transparent glass, there you will put your cells. So how do you put your cells? Your this finger, the second finger will be here and then you press it and then make a smear. Either you can take a straight smear or you take a wavy smear so that the cells come. On both the surfaces you will do the same. On the frosted surface, you can put a sticker and you can write ectocervix. But if you do not write also, then pathologist can identify because there will be squamous cells since it is in the ectocervix. Similarly, we will now take cells from the endocervix. So this is an endocervical brush. Endocervical brush is put inside the cervix and then you rotate it 4 to 5 times so that cells come, and then take this endocervical brush out and then again take a new slide, frosted slide, and then on the transparent part you keep on rotating it and taking all the cells in the smear. So take it. Then you can either label it as endocervix on this part, or you may not, because pathologist will understand. Once both the slides are ready, then you can fix it with 95% ethanol. For this, you can either put it in the jar where there is 95% ethanol ready, or sometimes fix a scum in the form of sprays. So you can spray it over it and it fixes. Once it is fixed, you send it to the pathology lab. They do H&E staining and then they identify the cells. So this is how PAP smear is done. PAP smear report comes by 6 headings upwards. It can be normal, which comes under the name of NILM, that is negative for intraepithelial lesion or malignancy, NILM. It can be an inflammatory smear, that is, it means it is infection, cervicitis or vaginitis. Number 3 is it can be ASCUS, ASCUS, that is atypical squamous cells of undetermined significance, means you are having some atypia cells but you do not know whether it is because of cancer or not. So it is 50-50. So in ASCUS you have to repeat the smear after a few 2 to 3 months. Okay, so ASCUS you need to repeat. Otherwise you can have low grade LCIL, that is low grade squamous intraepithelial lesion, or HCIL, high grade intraepithelial lesion, or it can be a frank